Shalom, everyone. Thank you very much for joining us. I hope you and the family, all of you, are feeling well and coping with this very challenging and I would even say stressful days. I'm also very happy we have the opportunity to still keep, at least via Zoom, to meet and connect and tell you about what we are doing here on campus. So I will divide my presentation into two parts. The first part, I will tell you a bit about some of the efforts we're currently doing on campus to help the fight against the corona, a worldwide fight, and also helping the country here in Israel in developing tests for corona. And then in the second half, I will tell a little bit more from my own expertise as a scientist, and we'll discuss how we can cope with these very challenging and stressful days just by learning what's happening in our brain and body and how understanding this process and what we can actually do in order to reduce the level of stress and anxiety. So I think many of you already know that with the new regulations, we had to send many of our employees to a forced vacation. We are only working with essential people on campus, which is relatively around only 30% of our employees. But despite this regulation, it's amazing what our scientists and technicians and students and postdoc are managed to do in helping the fight against the coronavirus. So one of the main efforts done in the last few weeks came after a request from the Prime Minister Netanyahu to help the country to increase the number of lab tests, clinical lab tests for corona. And as all of you know, we are a research institute and we have research lab. We don't have clinical lab. We don't have a certified clinical lab. This is the reason in only a week, we transformed many of our labs to be a certified clinical lab in full cooperation with the Ministry of Health in Israel. And our first big center is currently within the Nancy and Steve Grant Israel National Center for Personalized Medicine, the INCPM, in which we took our equipment, which is a state-of-the-art equipment, which on a daily basis is used for conducting research, and we transformed these equipment into two main lines that can do thousands of corona tests per day. We actually started recently running samples and people are working 24/7 to conduct research. We have more than 200 volunteers, students, postdoc, technicians, scientists that volunteer to do those tests. And the efforts are really unbelievable. And all this is added by Professor Robert Floor, as you know, is the director of the INCPM. And we are very proud in what they managed to do and the support we are getting from the Minister of Health and from our own Weizmann family. So this unit is doing or using the same exact protocol, which is used in most of the world and also in Israel by the Ministry of Health. I mean, the protocol of how to collect the sample and how to conduct the PCR, which is relatively an expensive and long process. At the same time, in order to try and increase the yield and make the test cheaper and faster, we also open another lab, which is added by Professor Eran Elinav and Professor Ido Amit from the Department of Immunology. And this effort in this lab is actually in those of you who remember the building in the campus, this is done in the Ullman building and the new Morris Center for Cancer Research on the first floor. And what Eran and Ido did, they aim, and in less than 10 days, I think, maybe 2 weeks, they managed to develop a new technique which allow us to do clinical tests for coronavirus, which is quicker and cheaper, meaning it's skipping one of the stages in the regular process, which take longer, which is the purification of the RNA. And this is done in a platform of 96-well plate and not by a single tube. which then with very sophisticated robots, we managed to move those 96 into 384 platform, which allow us to run around 20,000 samples per day, which is, of course, almost 4 times what is done currently all over the country. This is a research platform currently. It's not yet approved by the Minister of Health to run samples. However, we do have a cooperation with the Israeli army, and we already ran soldiers last week. And next week, we're going to start running other samples coming from the hospital. And we really hope this will be adopted by the Ministry of Health, and we're gonna start running clinical samples coming from the hospital, but also the general, of course, public, as soon as it will be approved. There's also a lot of interest worldwide about this method, and I think starting next week, more and more people will start hearing about this, not only from the Weizmann internal news, but also from the public and general news. And again, also here we have so many volunteers, students and postdocs. Also the equipment, which is this lab is equipped with, is being gathered from all over the campus. Different labs donated their own PCR machines and robot, and all this has been built and headed by, the whole operation is headed by Ziv Reich, the vice president. So these are the two main efforts which we currently at the Weizmann have done toward clinical tests for coronavirus. And however, at the same time, in parallel, many groups, many labs, many scientists started other initiatives in order to start developing new tools for preventing the infection or treating a patient, developing either vaccination or small molecule. And I will tell you very, very briefly about only 4 of these efforts. We currently have more than 50 different projects around the coronavirus. It's divided to many different field and subfield, but when you deal with treatment and prevention, you have 2 main approach, and one is developing vaccination, and I will tell you about this in a minute. And the second channel is to develop small molecules, which will eventually prevent from the virus either to infect our cells or to proliferate in our cells. Some of you attended the talk in the online, the Zoom meeting with Dr. Neil London or Ron Diskin and other. If not, all these presentations are also available online on our website. So I really encourage you to go if you want to learn more detail that I will not be able to cover here today. So near London, from the Department of Organic Chemistry, is part of a very big international project, which is running with Oxford in the US and Oxford in the UK, and of course labs in the US and also Germany. It's an open source consortium in which there is the free flow of information and reagent between these groups. Nir is the one who is adding these efforts, and is using a computational model to screen small molecule which can bind a very specific protein at the coronavirus, which is very important for the virus to invade into our cells. And since Nir is a structural biologist, he can use this program to really predict where those molecules can bind. And he already screened more than 1,000 molecules, and he identified 60 molecules which can be a potential target or treatment for the corona. Now they narrowed the list into 30, and they're really working in making the best molecule that will be able to be used as a drug. This molecule has been sent to the colleagues worldwide, which are checking the efficiency of this molecule in treating the disease. Another important effort is done by Professor Sarel Fleischmann from the Department of Biomolecular Sciences. And Sarel is also using computational models. Sarel is expert in proteins. And as you know, antibodies are proteins. And by using computational models, Sarel is also using his knowledge, which is also an open source algorithm that can predict, again, the binding of antibodies into very specific proteins, a different protein, the one from Nir is doing. And but again, is developing this what we call small nano antibodies in order to create or generate the best approach to develop new antibodies against this disease. And also Sarel is progressing very well, and we have all the diverse and strong core unit at the Weizmann assisting Sarel in pushing this project forward. You may know that before the corona pandemic happened, we actually had only one lab at the Weizmann, which was really working on lethal viruses. And this is the lab of Ron Diskin. Sorry, he's in the Department of Structural Biology, not Biomolecular Sciences. And Ron worked before on HIV and Ebola, so he was well familiar with the viruses. And for him, the shift toward working with the corona was relatively easy. And Ron is using two parallel approaches. In one hand, he's using, again, very similar to what Nir is doing, screening for small molecule that will be able to target the virus, targeting a different type of protein on the virus. But in his other project, he's isolating with his colleagues antibodies which are isolated from patients that were infected, show symptoms, but now they're healthy and are carrying antibodies in their circulation. So they're isolating these antibodies. They're learning the structure of this antibody, and then they can try and mimic and fit using different computational molecule that can bind in specific site, different pocket site of this virus or antibody. In a very different type of approach, we have the project of Professor Ron Siegel from the Department of Computer Science and Applied Mathematics, and Professor Benny Geiger, the head of the Department of Immunology. And what Ron is doing, and this is also done in collaboration with the Hebrew University, Professor Yuval Dor from the Hadassah and the Hebrew University. In general, it's something that is very common during this crisis. There's so many collaborations, and people don't care about credit, people don't care about patent. Everything is open source, and people are sharing and working really day and nights in order to make a progress. What Ron and Benny did is they developed this relatively simple questionnaire that is sent throughout using different platforms, either WhatsApp or Facebook or general newspapers and TV. And people fill this daily questionnaire about their symptoms, how they feel, whether they have fever, don't have fever. And by using computational model, using artificial intelligence model, Eran and Benny can really predict the spread and the outbreak of this pandemic within Israel. And they made amazing prediction about where's going to be the next jump in people which are infected. This, of course, allowed the authorities to focus their effort into specific cities or even more specific neighborhood within the cities. We currently have around 400, 500,000 people which are filling this questionnaire on a daily basis. And we have many, many countries around the world which are currently adopting this computational approach and questionnaire approach and helping them fight this virus. So this is only 4 different type of projects in addition to the test I already mentioned, which are currently running the campus. But as I mentioned, we have at least 40 more which are targeting different pathways on the virus proliferation, integration, infection, and other computational approaches about the spread. Many of our scientists are currently busy with what we call the exit strategy. So far, we're very busy by blocking this virus and the infection and make sure that the people are sick and get treatment. But currently, we need to start thinking about the near future. We hope it's going to be the near future. And this is the exit strategy, how we going to start going back to work and getting the economy stand up again. And this is involving a lot of predictions, people coming from totally different fields, from computer science to mathematics to physics to biology and even psychology. And this you're going to hear more and more in the next few weeks about this exit strategy and how we will behave, because apparently this is here with us to stay for quite a while, and we cannot maintain this type of keeping people under quarantine for longer periods of time. Very additional and important activities, and let me move it directly into the English version, is the amazing activities which are done by our educational arm of the Weizmann Institute, which is the Davidson Institute. And as you know, the Davidson have many activities for kids, and in Israel and many other countries, kids from different ages are stay at home. They cannot go to school, which is not easy for them. It's not easy for sometimes for the parents. And very quickly, after a few days, the Davidson team managed to open a site called Stuck at Home and incorporate inside many, many activities. On a regular days, as you know, our website is in Hebrew and Arabic, but a week ago, even a little bit more, in a major effort, they managed to translate many of the activities already in English. Unlike thousands of entries every day, we have tens of thousands of entries to our website and activities, and they are now busy with translating those activities also to Spanish, which hopefully it will be online very soon. Okay, so I will stop here at telling about the effort that the Weizmann is doing. Again, this is only a very small part. Yeah, I definitely use more than 15 minutes. So I will try to make the second half shorter. But this is, as I mentioned already, this period is extremely challenging for us, and I would say even very, very stressful. And I think we are very good in assessing our state, our mental state, our state of stress. If we are stressed, we know, we feel it. We also are very good in assessing stress in our loved one. Yeah, we can look at our family members, our parents, our kids, our spouses, and we can feel if they're stressed or not stressed. And the big question is why? Why we need those feelings? Why the brain is doing this to us? And I want to explain a little bit what is this process. So let's imagine this scenario. Yeah, we are sitting on the sofa reading, of course, an article just published from the Weizmann Institute, and then we get this SMS, a message that we have 247 new COVID-19 cases in your area. Most of us will perceive this message as stressful. And in a millisecond after reading this message, your brain will activate what is known as the central stress response, or the stress response. And most of you, all of you, can describe the feelings which are associated with this activation. You're going to have a massive increase in your heart rate, in your blood pressure, in your blood glucose level. It will jump from 100, 160, 180 just by activating this response. Your respiration will increase. Your cortisol level, your stress hormone level will increase. But not only peripherally, not only in your body, also centrally within your brain. The level of your emotions will change. You will have increase in your fear and anxiety. You're gonna have changes in your cognition, in your memory. Your locomotion is gonna change. Some of you will freeze. Some of you will start moving faster around. You're gonna have changes in your attention focus. You're gonna have changes in your appetite. So almost every major center of your brain will respond to this type of stressful uh, stimuli. However, this is a totally normal and a healthy response. I remind you that this response is highly conserved through evolution all the way from fish to human. And the purpose of this response, it's a survival response, is to allow you to cope with the challenge. But unlike a situation in which someone just, you were riding your bicycle and someone just cut you with a car on a sidewalk, and this response will be activated, heart rate and blood pressure, everything going to increase. In a minute, this stressful is not relevant anymore. The system, the brain will switch off this response and will restore homeostasis, meaning it will reduce will switch off this activation. You bring all your systems back to the original steady state. And this is a normal and healthy response. However, during this pandemic, the fact we are continuously exposed to more and more stress, this uncertainty, or the news we are hearing, and the fact we are locked in this situation for weeks and hopefully not months, putting us in this chronic stress mode of activation. So our system is upregulated, not always of course, in the highest level of activation. However, this chronic exposure is, of course, putting us in a risk, and some of us do feel it in different ways. And how this is manifested, and what we, of course, know very well from the literature, is the fact that when we expose to this type of chronic stress or other type of chronic stress, and when we don't properly regulate this control, when you don't really minimize this exposure and really allow our body to properly shut down and respond, this is strongly associated with a large variety of disorders, all the way from depression and anxiety and eating disorders, or not only psychiatry related, but also metabolic related and heart related and immune related. Therefore, as much as we can reduce the exposure or try to minimize the level of stress associated with this current crisis, we all going to benefit. So, but how can we do it? Or maybe just mention before I suggest few things, and I'm sure all of you can suggest similar or even more or other things. I would just mention that in addition to the fact that all of us are very worried about being infected, or our loved one will be infected, or by the uncertainty associated with this, meaning work related and other issues. We have also other stressors which are due to the situation. Of course, many of us are in isolation, which is not easy. Isolation is one of the most common causes for depression. The fact that we are now stuck with family member 24/7, some people like it, some people like it less, and it's definitely creating some conflict. I don't know why the lady here is the one which is upset, but I'm sure that it's equally distributed in the population. The fact that we are hearing news almost at least in Israel, on a half an hour basis, is another source of stressors and so on. And most of the things I would usually offer people I would just mention this before because it's important. Despite everything I just said, it's really important to remember that both the way we perceive those stress, this pandemic, and the way we also respond to it is extremely individual. Some people really enjoy the situation, but I would say they are the minority. Some people are not getting very anxious about this and say, oh, it's fine, don't worry, I will have more time to work in my garden or do other things. But other people are extremely anxious about the situation, and it's definitely affecting. And if I see from my colleagues around the world, And in Israel, of course, psychiatrists, I can see this increased number in demand for treatment. So the usual, another important probably difference is the difference between men and women. And as I'm sure you know, both the behavioral and the hormonal effect of stress is different between the sexes. And I'm not going to go into the mechanism and why, what are the reasons. It's just to emphasize the fact that female and women are 2 to 3 times, or the prevalence of stress-related mood disorders such as depression, anxiety is 2 to 3 times higher in women than in men. This is something we also need to take into consideration. So even regular days when you stress, I will tell you, oh, just go ahead and have more social contact, social event, enjoy, not necessarily drink alcohol, maybe one glass of wine is good. But in these days that we are forced for social distancing, of course, we cannot do that. We cannot go to crowded places. We cannot go to the movie. We cannot go to the concert, the opera. And the same things, we need to avoid hugs and kisses, which is something that's also very comforting. Traveling the world in Israel, it's very common in our neighborhood. People like to relax, so they go far away and try to and just enjoy traveling. And this is something that is also we cannot do today. So we need to find other ways and other solutions to stay calm and reduce the stress level. So one way to do it is what we are doing now. Use Zoom, use other platform in order to communicate. In few days, we're going to celebrate Passover, Pesach here, and I think one of the most common instruction program running now in WhatsApp is how to teach your grandma and grandpa to use Zoom. And this is a great way to continue communicating with your loved one and friends. This is the way the education system in Israel, in high school and in university, are continuing to run, and we should use it and use it as much as we can. Another way which doesn't require a lot of space, and you can always do it alone, even better doing it alone, is any type of meditation or mindfulness. You know, as a scientist, I'm always trying to use methods which are scientifically valid, and there is a lot of literature about mindfulness. And definitely something that is relaxing. Those of you who are not familiar and didn't get training, there are different ways, different apps to try and do it. There's a lot of online program to try and do it. I have to admit that personally, I started doing it recently, regardless of the corona. And I think it's fantastic. Maybe not to everyone, but those of you who find it useful, I think you should use it, this or any other type of meditation. Many of us are using psychologists, many of us doing psychotherapy, talking to someone. I know that most of psychologists, psychiatrists are continuing to work online. I know it's different and a different feeling. It's a very different feeling for me now to talk to all of you, around 500 people, and I don't see you. I don't watch your faces, your responses. And I see only myself in the screen and the slide, which is very different, but I think you get used to it. I think I did it already 4 or 5 times and you get used to it. And I think those of you who need it should continue doing this type of meetings and discussions and treatment as much as you can. But of course, it's a very personal. One of the things that is probably the most scientific is exercise. Unfortunately, we cannot go now and start running. In Israel, it's limited, I think, now to 50 or 100 meters. And I saw yesterday someone is running around his house. But it doesn't have to be running. You know, it could be any type of activity, even muscle activity. Everyone, he or she, according to his limit. You don't need to be an Ironman in order to benefit from this. Scientifically, we know this is increasing the number of newborn cells in your brain in areas which are extremely relevant to your mood, to your cognition. It's mimicking the effect of antidepressants. So as much as you can do activity, even within your house, within your apartment, I think this is a blessing. And of course, any other type of activity, those of you who can walk, can run, even if it's in a short distance, this is something you should do. Here at the Weizmann, of course, we're lucky to have our gated campus, so we can enjoy our beautiful campus and our green campus. And of course, all of you are good friends of the Weizmanns. Just stay in touch. Go to our website, go to our YouTube and Facebook and Instagram, and follow the activities that are done here on campus. Is so active and is so changing on a daily basis that I really recommend going every day into the website and see what is new. So I will stop here, and thank you very much again for the attention. And let's start with the question. I'll take my phone and see if I already got something. Wow, okay, I have many. Okay, I will start. There's a long list of questions. What are the best possibilities and timeframes for the development of treatment of vaccine? It's a fantastic question. I know it's really, really hard to predict. I remind you that we have viruses such as HIV or Ebola that, I don't know, 30 or 40 years, we don't have vaccine yet. So although we hear almost on a daily basis, different countries, different companies, different institutions just about to develop a vaccination, it's really, really hard to predict. So there is the stage of development, which can take months, if it's working, many months. But then don't forget, we need to scale it up. We need to make it accessible for the public. So we don't see vaccination or development of vaccine as something that will come on the time frame of weeks. Either it will be many months or years on none. This virus is changing. It's hard to see how is the mutation and how fast it will change, mainly because we don't have a treatment yet. In a minute we're going to have a treatment, we're going to force the virus to start. We're going to do a selection in a way. It will start changing as soon as we're going to start treating it. So it's a lot of unknown about the vaccination. What will be very effective, and it's of course related, is isolating the antibodies, the immunoglobulins, what we call the IgG, from people who were infected, but they are now healthy. And this is a lot of efforts worldwide to isolate those IgG from the blood of patients. This could be used as a treatment. Of course, it's a short-term treatment, but people which are in emergency care and other people could definitely benefit. So as long as we have more people which actually cope with this, were infected and are healthy and will donate blood, this will help isolating those IgG, those immunoglobulins. How does Professor Elinaven admits faster testing compared to Abbott lab 15-minute test used by President Trump yesterday in a ruling? Okay, I saw this also in the news 2 days ago, what the Abbott, I think it's a similar concept, which is a sequencing based. Of course, I'm not familiar exactly because it's not public about the technology of Abbott and how they do it. I saw also the article. Knowing very well what Ido and Eran are doing, this is based on a similar concept. But of course, we give it free of charge. We're going to share the knowledge with everyone. I think most of institutions worldwide, unfortunately in Israel, the academic research institution like the Weizmann and other universities have better equipment than the Ministry of Health or the clinical labs of. So adopting this, making similar labs like we developed here, would definitely can increase the numbers of tests. There's a lot of other hurdles on the way, which I'm not getting into, which is really changing the way we are currently collecting samples, okay? The classical tests, I don't know how Abbott are doing this, but The collection of the samples currently in Israel are doing with those long swabs and in a single tube. And our protocol now is using very small swab going into your nose and going into a small well in a plate. But to the best of my understanding, the technology is very similar, but we will see in the next few days. Okay, I will read it again, then I will try to understand the question. I'm sleeping 50 to 60% of time, still studying mechanical engineering, but I cannot feel an atmosphere of normality, especially related to my recent tiredness all the time. How should I manage myself and fix it? Also felt less appetite as well. This is definitely, symptoms of, could be symptoms of stress, but could be also symptoms of less activity. I'm avoiding giving clinical recommendation because I'm not a clinician. But for my common sense, and I'm sure you're going to hear similar things from your doctor, is just try to increase activity, try to be more active on a daily basis, doing more breaks. Maybe don't go to sleep so much, even if you feel tired, but definitely consulting with a physician would be a good idea. But I think it's normal. I think many people today feel the same, because definitely in one way changing our routine, the amount of activity we are doing in our daily schedule on one hand. On the other, we are much more stressful about the situation, mainly from the uncertainty when we're going to go back to school, when we're going to go back to work, when we're going to see next my mother, which is 81, and I cannot see her for weeks now. So this is a normal response, and most of us can cope ourselves by doing different things as much as each of us can do, either working on the garden if you have a garden, or reading a book, or doing something else. And many of us, some of us cannot cope well, and those who cannot cope well should ask for some help and don't keep it. And there's a lot of help around. So, and it's amazing to see how many people would like, how people are engaged and would like to help and assist others. I didn't see such a collegiality for many years within the scientific community, but also within the country. People are extremely polite, and in Israel it's not it's very evident, I think there are ways to cope. Can we go in even deeper lockdown? Is there a chance the institute will be closed for everything other than corona research? It's a fantastic question. Things are changing almost on a daily basis. The first 2 weeks of this crisis, all the presidents of the institute, we fought very hard with the government not to lock the places. All the scientists are allowed to come, but we have to minimize the number of people on campus. So we are limited every lab to 4 people in each lab. So each lab is monitoring who is coming and how, just in order to keep the social distancing. However, we have a total number for the whole institute, and since we have to keep essential systems like the animal facilities and and pumps and water and electricity and gases and other things, we have to first focus on those. Otherwise, you're going to have a very long-term consequences of what will happen in the next few months. There are experiments which are here running for years, and we really need to maintain them. We currently do not predict that things will be percentage-wise, at least, worse than this regarding the lockdown, at least not within a research institute. We do have a plan for that, just to keep really the basic and the minimum. We have all our corona people exempt for this, so we have around 250 people currently on campus just around corona. And these got permits from the government, of course, to continue in working. It will be very hard to go lower with the number and still keep this place running. The way with the number of infection currently in Israel and the situation, we are very optimistic. We don't think we're gonna have even stronger lockdown than we currently have. Intermittent lockdown are mentioned as a trade-off between spread and the economy. The US seems to be moving to a trial and error approach of existing, informed by the health and system capacity. Germany seems to be using a massive test to lift the lockdown. This is a fantastic question. So there is, as I mentioned before, there is now the main focus of most of the committees, and I'm involved in many of those committees now in Israel, is focusing on the exit strategy. And definitely the exit strategy will be based on much larger number of tests. In order to allow people to go back, you want to release people back to work if you know they are not infectious anymore, whether they were sick already, and we know currently we don't have any evidence for multiple infections. So if someone were infected and is now healthy, he will not be infected again. There was at least one study in non-human primate which confirmed this. We don't have any known cases that I know in human of secondary additional infection. So the idea will be to start bringing the economy back into normal by releasing either very specific group of people or very specific places, meaning we will need to really monitor. So if you have a neighborhood which is have 30% infection, the chances you will go out of this neighborhood is extremely low. In vice versa, if you have a neighborhood which is clearly you have not any infected people, a very small percentage, they will allow people to go out. And this is the strategy that Israel is currently planning, or this is what the committees, the academic committees are recommending to the government to do. I think the US, at least what I'm following in the news, is I think around 3 weeks back from what we are currently doing in Israel. If you look on the mortality rate, you can see that Israel is actually in the best situation. It's with Israel and then Germany and then the rest of Europe. And of course, US. We can learn a lot with what has been done in China and South Korea and Singapore. And it was based, at least in South Korea, it was heavily based on a lot of tests and of course a lockdown. So this formula is definitely working. Following the above statement, as I just mentioned, sorry, how would you go about lifting lockdown in a way that is manageable until we reach herd immunity or vaccine? So this is exactly what I described. We need to do, at least in Israel, we are 8 million. We need to do tens of thousands of tests every day. We need to aim to do 100,000, 200,000 every day, which I think is feasible with the new technologies. And then slowly come up with models, with mathematical models throughout the country and say, this is a clean area. They can go to work. And when they go to work, we need to make sure they are interacting only with healthy people and so on. I think those type of models will start being released soon into the public. There's many smart and good people working on developing those exit strategy model. I hope I'm going on the right, because it's jumping the whole time. So how long the virus active on surfaces, when it is safe to touch the surface? Okay, so these few studies came out. This study already for more than 3 weeks ago, talking about hours to days, depending on the surface. Okay, whether it's a metal surface and with the metal, which type of a surface, and then cardboard or others. So it's between hours to days, to many days. I even studied talking about almost 2 weeks, 13 days on surfaces. And this is the reason the best protection currently are actually gloves. Gloves and keeping washing or using alcohol gel and things that we have here. You see what I'm going with, this big bucket of alcohol wipe. That everywhere I go, when I go to the elevator, I'm using this. When I go to the bathroom, when I open door, I use this type, so any other type. So this is the best. We still need to wear masks, but I think the majority of the infections, unless someone is really sneezing on you or coughing on you, probably the majority of infections will come from touching surfaces and then touching your face, mouth, nose, and so on. Okay, why do women have more stress than men? Can you explain the science behind it? Okay, this is beyond the corona, of course, and it's not having more stress, it's the way they respond to stress. Of course, I'm talking here by average. If I'm measuring cortisol, the level of cortisol would be higher, and there is again, of course, in behaviorally, there is differences, and there are two. I will not go to the I would say evolutionary reasons, okay, which we can all think about it through evolution. Of course, the role of women was to protect the offsprings. Of course, if they are more alert and are more, searching the environment, they're more alert, they be more jumpy, and they can protect more their pups. So this is the evolutionary concept. However, we know that biochemically and molecularly, cellularly, testosterone is an inhibitor of the HPA axis, of the hypothalamic pituitary adrenal axis, the release of cortisol. So it's not that in female this cortisol axis is more active, is the fact that this axis in men is inhibited. So this is one of the explanation. Also through development, meaning estrogen, or this, not only circulating estrogen, but also estrogen through development is wiring the brain in a way that the response, the behavioral response in female is different. Again, don't look on individual cases. We have a lot of female who respond much better than male if you look on the average and the whole population. I hope it was clear. How is the people from rural Israel coping with the crisis? Can they buy groceries online, or that is adding stress to their daily life? Honestly, I don't think so. I think this is one of the first cases that people living in dense cities have more stress than people who live in rural area. Of course, food, we don't have any shortage in food and groceries. People can still go and purchase everything they need. Supermarkets are open. Of course, they're controlling the access and the entrance, and people have to wear masks, and people are keeping this 2-meter distance, and only a specific number of people can go inside. I went today at 6 a.m. to avoid the lines, and I went out at 7 a.m. out of the supermarket, and it was a line which was at least 1 hour line, because everything is much slower. You can still, of course, order online to make it longer than usual, but I don't think we have any issues with getting food or groceries. There is a lot of organization that now are delivering food to elderly people who cannot go outside, and it's really in Israel in its beauty. It's really amazing how we operate in these days. I have to admit, as a country which is used to different type of crisis, and the fact we do have the army is extremely helpful. We started yesterday a huge project by sampling all the policemen in Israel, and just for coronavirus tests in the INCPM, and the people who collected the samples are soldiers. We have 25 group of soldiers came 2 days ago in the morning, got instructed by our scientists, drove all over the country, and in the evening came back here with 1,500 samples, and the plan they're going to do it again on Sunday morning. Do you believe and would subscribe the strategy of massive testing, certifying individual and returning those that are supposedly immune back to work? Yeah, of course, there's a lot of side question to this. And the question, if someone that is already been infected can go back, currently, to the best of our knowledge, yes. We just need to be confirmed. I don't know what is the gold standard worldwide. In Israel, someone who was infected is tested twice. After the 2 weeks of isolation, he's tested once. If he's positive, we wait another 5 days and tested again. If he's negative at the second day, he can go back, currently home, like any other citizen, but cannot back to work. I do support, with the knowledge we currently have, and this is my personal impression and my colleague impression, that massive testing will be beneficial for this. Of course, ideally, we should have not only a PCR type of approach, but serology, whether we can really look for antibodies but today there is not sufficiently good test to do the serology or the antibody test with high efficiency. Is the Ministry of Health acting in a swift manner to properly coordinate testing and treatment occurring in institutes across Israel? Is there room for improvement? Yes, there's always room for improvement. It's not easy. There's huge pressure on the system, especially in the Ministry of Health. We have a daily, I think I have today 5 or 6 or 7 talks, phone calls with the Minister of Health, with the head, try to improve processes. It's not easy. Many of the things have tough regulations, and me as the president of the Weizmann also always need to think about the Weizmann and our strength and health and our exposure to lawsuit in the future. So there's a lot of discussions that I'm currently not sharing, but it's always in the background of those efforts. But if the question whether we can do more, yes, definitely we can do more. From the government side, I think we are maximizing our effort here within the Institute. It's not easy to change routines. If we need to change the way we collect samples in the population, it will require some logistics and they will need to adapt accordingly. But I think the next week or two are going to be really critical. Although we're going into Passover week, things will continue to run and have to adapt. Wow, this is a tough question. For how long will we be confined? What is your guess? If you are talking about Israel, I think it's very different from different countries just by looking on the number. Israel currently, at least the slope, the curve is starting to be flattened. It's going down. I think it's really dependent on the economy. I think what the government would like to do is as soon as possible to start getting people back to work, especially the essential people. If you ask, for example, the education system, I don't think that high school or universities are in a high priority to go back because they can continue studying online, the majority of them. However, it's important to have kindergarten going back or law school just because then their parents can go to work. So it's going to be gradual, but it will happen. Not a profit, but I think it will probably be a few weeks before we can start releasing the hold. But the worst case is then we release it, people feel safe, and then we have a second wave, and second wave can come. So we have to be extremely careful. We need to learn to live with this for a few months, definitely. Some of the models are talking till September, October. But then, of course, we cannot keep this level of lockdown till September, October, because the system will collapse. So I think they will start releasing it, but in a very controlled manner. Some say it is not good to promote the view that stress causes disease. Okay, so some people can say, we cannot argue with science. It's of course not a black and white. When I talk about stress can affect you in different stages of your life. It's not only the environment, it's not only the stress which is outside, it's also, of course, your genetic makeup. And many of us do carry what we call genetic predisposition to develop those diseases. Meaning, if I do not have genetic predisposition, I can live a very, very stressful life, but still don't develop a disease. However, many of us do carry genetic predisposition to develop many diseases. Could be depression or anxiety, or also cancer or Alzheimer. What eventually will determine whether they will develop or not develop a disease is the environment. And within the environment, stress is the most significant factor. So I have to disagree, but doesn't mean that everyone will be exposed to stress will develop a disease, of course. Yeah, some of us will. Are there budget limitation to the work at Weizmann? How can we help? Wow, of course, meaning that it's always a limitation in budget. This is, of course, we didn't expect this Corona pandemic. We didn't budgeted any of what we do now. I have to be honest and say that even what we do for the government, we're currently doing on our budget just to save time And I have to say, thank God that we ordered what we ordered 3 weeks ago to run those tests, because currently worldwide there's shortage in reagent in order to do tests. This is the main issue currently worldwide. We have enough labs, but we don't have enough reagent. And we do have a nice stock of reagent to run many of the experiments many of the tests we are currently doing. But support is of course needed. It's heavily needed. We started this fund. I think we already had around $4 million within this fund, ranging from very small donation to a bigger one. But every help is of course welcome and important, and extremely appreciated. I think there's more questions, but I think I will just, because of the time, I will need to stop here. And I would like to wish you all happy Passover, Pesach Sameach, and please stay safe and healthy. And in Hebrew we say, עברנו את פרעה, נעבור גם את זה, meaning we went through Pharaoh, we're also going to survive this. So please be patient and listen to the regulation, keep yourself safe and healthy. And thank you very much for your time, and please stay in touch. We care very much about you as you care about the Weizmann. So Shabbat Shalom, have a nice weekend, and thank you very much. Bye-bye.